beautifully done video. Yeah, it's with great pleasure that I bring the last couple of Avengers on here. It's like girl power. We've been highlighting just some fabulous people from around the world, but last but not least, and perhaps my favorite too, Avengers are on today. So we have Richelle Flanagan, who will be teaching us a little bit about her work in a few moments, but and Omotola Thomas, who is just inspirational as well, who brought that video together and inspired so many people around the world to care about this. And we've had, I think, probably over the last 5-6 weeks, a number of the Avengers, starting with Ben, who who talked about Omotola's work, and then a number of other causes around the missions of the Avengers have been discussed. But we're really going to be highlighting the global needs of Parkinson's patients today. And I think that video, teaches you a little bit about the issues that are going on in Africa. So without further ado, I wanted to introduce Omotola and have her teach us a little bit about her journey with sort of getting diagnosed with Parkinson's and kind of where her journey has led her through to meeting up with the Avengers now, and sort of the missions of the Avengers that she's been focused on.
Thank you so much, Indu. Hello, everyone. It's a pleasure to be here today. I will try and condense my story to as short as I can. I was born and raised in Nigeria, and I moved to the US when I was 20. I lived there for about 13 years, and somewhere in 2010, I noticed a twitch in the forefinger on my right hand. And from 2010 to 2015, other symptoms, accompanied the twitch. It evolved into a full-blown tremor, muscle rigidity, weakness, all sorts of things. And then in between that, my family and I moved to South Africa. Doctors there wanted to start their test all over again. Long story short, 2016, almost 6 years after my first motor symptom, I got diagnosed with Parkinson's here in the UK at the age of 35. Almost immediately, I got myself involved in the Parkinson's, in volunteering for Parkinson's organizations. For me, being silent was equivalent to, silence equaled subjugation for me. And I knew that if I kept quiet about my illness, it would overcome me and it would overpower me. So my way of dealing with it was being out there, getting more information, more resources, educating myself and connecting with the community. And in the process of connecting, I realized a huge void, which was that there were so many different support groups online and in person for men with Parkinson's, young onset Parkinson's, women with Parkinson's, Christians with Parkinson's. But I didn't find any support group for Africans with Parkinson's. And one might say, why do I need a support group for Africans? Well, I felt like there were unique challenges that I faced, not more difficult, just different challenges that I faced as an African with this illness. One of them, which I talk about often, was me losing the ability to be able to manage my Afro kinky coily hair and losing the ability to do that for my daughter. And that was a very painful loss for me, especially when I moved to England and I had to rely on other people to help me get my daughter's hair done, something that I was able to do with ease. And another thing is there's certain foods that we make in West Africa that require certain dexterity and fine and gross motor skills. I lost that ability and I couldn't do that for my family as well. So these were unique challenges that I faced that my American and my British counterparts didn't necessarily understand. And I had no one to go to talk to help me navigate through those waters. And it was a really difficult period for me. And so almost immediately I had this idea to start to create some type of support service for Africans with Parkinson's disease. So I went online and I Googled Parkinson's disease in Africa. And one of the top results that came up was, it said, although Parkinson's occurs worldwide, little is known about Parkinson's in Africa. And I thought, that doesn't sound right. So since then, I've been trying to find different support groups, different resources, different scientists, researchers, and that has spanned almost 2 to 3 years. And the accumulation of all of that effort is what you saw in that video. Over time, I was able to get connected with different support groups that have been in existence, some of them for years. I just didn't know about them because they didn't have social media visibility. Some of them were newly created. And it was really, really inspiring for me to see the amount of work that these guys are doing with the limited amount of resources that they have available. Many of these support group leaders, not many, all of them actually, take money out of their own pockets because they don't have the same type of fundraising efforts and abilities that we have here in the West. So many of them all of them take out of their personal money to fund the support groups, and part of their work is not just Parkinson's. They also have community outreach work because many of the patients are not able to afford food, excuse me, or transportation to get to their support group meetings. So when I got to meet these support group leaders and I got to hear their stories, I wanted to do something because many people have said to me, particularly Africans, oh, we don't have Parkinson's here in Africa. It's, something that is prevalent in the West. And I wanted to be able to show not just people outside of Africa, but Africans themselves that, look, we do have this illness on the continent. I don't know what the prevalence numbers are, but we have enough that we have people that have created support groups in order to support these patients with Parkinson's. And so that's why I put the video together. I just want to highlight the work of the guys in Uganda, Kenya, Nigeria, Ghana, Ethiopia, South Africa, and Cameroon, and tell them that I think they're doing an absolutely amazing job. They inspire me to do what I do, and I want to thank them for all their efforts.
That's amazing. I mean, you're also compassionate and loving of each other and supportive of each other's work too. I think it's just brilliant. I love seeing the love. So, so a couple of things. One of the things that you guys have been doing to really highlight the issues around the African needs and has trickled down or up or whatever you want to call it into even our movement disorder society. So this year they just had the inaugural sort of a Africa specific steering committee and at the International Parkinson's Movement Disorder Society. And I know that you've been working with Dr. Badejo, is that how you, yes.
Yeah.
Could you tell us a little bit about her work? Because she actually got an award, I think, this year, and people have been really, impressed with her work. I'd love to learn a little bit more about it and what you guys have been doing together.
Yes, she is a very inspiring woman. I got introduced to her about 3 years ago by a fellow PD Avenger, Eli Pollard. Eli introduced me to Professor Badejo. And almost immediately, I could tell that she was very dedicated to the work that she does and very, very concerned about Parkinson's patients. So we got talking and she's given me, how do I put this? Through her, she's given me so many different contacts in and around Africa to be able, in terms of researchers, neurologists, doctors, and other different allied health professionals. She's currently in charge of the project that I was able to start, I think a year ago, where we were able to get funding from the FAR Foundation. Thank you very much to them, who agreed to fund 100 Nigerian patients with their medication for a year. So Prof is handling that project, and she's helping me with the setup and connecting me with different people for Parkinson's Africa as well.
That's amazing. Well, kudos to you guys, because I think having a real voice at the Movement Disorder Society will have some effects, I think, and it was a much needed sort of introduction. So I'm really glad that you guys are working together. So it seems like there's a few things that are really problematic in Africa. One is that there's a stigma. People aren't willing to admit about having the disease, and really, I think there was a quote here about a woman who is the founder of African Parkinson's Disease Foundation in Nairobi. Helen is her name, whose father had died of Parkinson's. People in her community had believed that her father was under a spell or possessed by demons, or that her mother had done something to get access to his will. So it sounds like there's a lot of education, first and foremost, about this disease and the fact that it's not some sort of something to be ashamed of, to even come out and talk about it, because it sounds like there's a lot of misinformation and in this. But then there's also, it sounds like, issues with some access to medication. I was shocked in the Ending Parkinson's Disease book to realize that a number of the countries in Africa don't even have Sinemet to begin with. Even if somebody had the funds to pay for it, they don't have access to that drug that is just, so part and parcel of our armamentarium. It's really sort of the gold standard medication that we have access to here. And then there's been, I guess, one other thing that you've highlighted is that there's the government agendas sometimes are looking at infectious diseases or communicable diseases, really in like malaria, HIV, TB. That's where they're supporting the cause. And then, you mentioned Nigeria, which is your own homeland, that there's a population of 200 million people, the 7th most populous country in the world. Probably 5% of people are age 65 and above, and Parkinson's affects at least 1% of that, of that population above the age of 65. So certainly just looking at the aging population, the numbers, there is a huge number of patients, and then these barriers, it sounds like stigma, sounds like access to medication, and government sort of lack of support. Could you maybe flesh that out a little bit, Omotola, and help us understand how we and the Avengers are trying to take that on?
So I'll start with the issue of, I guess, stigma and access to medication, and which was one of the reasons why the Avengers came solidly behind supporting the video that you showed at the beginning of the hour. And I want to thank my fellow Avenger who's on this call with me, Richelle, for promoting the heck out of the video. They really, all of them, everyone really came behind that video and pushed it. We were able to raise over $11,000. All of that is going to be used to purchase medication. But when it comes to access to medication, there are a couple issues. There's the issue of availability. Is the drug actually available in the country? There's the issue of accessibility. If it is available, is it at a location that patients can reasonably reach? And then if it's available and it's accessible, then there's the issue of affordability. Can they afford it? And usually most patients cannot go through those 3 A's to the end. They either encounter one roadblock or the other. And then the issue of stigma. I mean, you mentioned a few examples, and it's not across all of Africa that everyone thinks that there's witchcraft, but the illness, like, when you're shaking like this and people don't understand why you're shaking like that, there tends to be a negative connotation around that, and you tend to be looked upon as somebody who is strange. I have a guy in Uganda, Huntington, who's doing amazing work with his support group over there. And the stories he tells me of the people that he has had access to who have been diagnosed with Parkinson's and the issues that they have faced. One woman in particular, he was told that there was a witch somewhere in some part of the village. And then he went to meet her and, saw that she had tremors. And he found out that because of her tremors, because of the Parkinson's symptoms she was experiencing, she had been holed up in a room for almost 10 years. And nobody wanted to talk to her. Nobody wanted to interact with her. They would slide her food in and out as though she was an animal. Because people were afraid. He himself, his mother died with Parkinson's when he was a young child, and his father left his mother and with his siblings because they didn't want the children to catch Parkinson's. So there's a lot of work that needs to be done in terms of educate, not even just access to medication, in terms of being able to educate the African community on what this illness is and what it isn't. And I'm hoping that international Parkinson's organizations and charities and communities will come together to support that mission.
Absolutely. That sounds so important. And so if we, Cinemac costs about $2 a day, would you say, in Africa, or how much do you think?
Yeah, it depends on the country. So in Nigeria, it ranges from about $20 a month to $60 a month, depending on the country. So I guess the $2 a day is fair.
Okay. And that's quite a lot of the daily income, let's say,
Oh, I mean, if you're talking $60, that could be somebody's monthly income.
So really the goal would be to try to manufacture these medications possibly in the country, make them as cheap as possible in generic form, and then try to distribute them equally throughout the country. Is that
exactly? And I know, I mean, one of the things that Prof told me about was that Teva did something similar a few years ago, where they donated enough levodopa for 100 patients for about a year. So it's something that has been done, has been piloted, and can be done again.
The problem is sustainability, I think, too, though. I mean, if we can start somebody on a medication and we don't have a way to sustain that, then it's really kind of not a great situation.
Especially when you're talking about Parkinson's meds, right? So that's another issue that we have to deal with. But like you said, if we can find a way to get it at a decent price and then get funding or support from corporate bodies, I think it, and you know, like even if we start with, maybe not start with a large number, if we start with a few patients that we can support in the long term and then see how we can scale that up as time goes, that's a way to do it.
Yeah, absolutely. That sounds so important. Well, I mean, we think that we have barriers here, but I guess, hearing some of these stories, it makes you feel, grateful that we have even what we have access to here and for our patients. But tell us a little bit, Omotola, about your you have a site called Parkinson Stand. Yeah. Can you teach us a little bit about that?
Yes. So shortly after the day I got diagnosed, actually, I remember I was alone. My husband was still back in South Africa with the children. And I left the doctor's office in an Uber. And most people would expect one to be sad after getting a diagnosis at 35. And I wasn't, I think because it had taken me almost 6 years to finally figure out what was wrong with me. So I remember leaving the hospital that day, determined that I was not going to let Parkinson's get the best of me. And I was going to do something. I wasn't sure what that something was. And I like to do headstands. And so a few days after that, I was practicing a headstand. And then I was shaking and I was laughing at myself. I said, I can't even stand properly on my feet. And I'm trying to stand on my head. And then then the words started ringing in my ears: Parkinson's headstand, Parkinson's headstand. And then I just joined the two of them together to something that I made up called Parkinson Stand. And what I defined a Parkinson Stand to be was any move or action that redefine the boundaries that an illness like Parkinson's tries to impose on you. And I just used that to start a blog where I started sharing my experiences. And I found that empowering because it was giving hope and inspiration to others, which in turn was inspiring me to try to do more and be better.
I love that. And I've watched you do some of those handstands in headstands. They're awesome. So keep doing that, I think. And I'm a big yoga fanatic. So as you know, so we'll have to do stuff together. Richelle was talking about jumping in the ocean together. We'll have to do some handstands as well, or headstands. All right, Richelle, you're not off the hook, my dear. So both of these ladies are just phenomenal. I mean, every single Avenger, when you read their profiles, and we'll link Parkinson, or I think Andrea's already posted some of these things, and we'll make sure that everyone has a link. We will try to, we'll definitely try to, kind of highlight all the good work that every Avenger is doing, but you two are just pretty spectacular. So Richelle Flanagan, wearing green for Ireland, both Omotola and I are wearing our African fabrics here, but Richelle is an amazing, force of nature. She was the one, she and I had kind of thought about the idea of hosting the Avengers on this platform and kind of giving them a space and kind of a place to talk about all of their important missions. And we'd had Mike Oken and Bas Blom and Ray Dorsey on early in our series to talk about the Ending Parkinson's Disease book, which honestly gave so many important relatively what I thought was low-hanging fruit, things that could be done to really make a difference. And so I urge people to get that book and try to look at the Parkinson Pact, sign the Parkinson Pact, get involved with the Avengers, sign up to be an Avenger. Just some really important missions here that should be part of anyone who is either living with Parkinson's, living with a Parkinson's person in their home or cares about Parkinson's. I think this is absolutely a must. So, but Richelle and I went through and talked about how to arrange these, and she really put a lot of work and thought into kind of bringing this series. So thank you, Richelle. So I wanted to bring some of Richelle's, fabulous credentials to everyone's attention. So she went to Trinity College in Dublin, which is a beautiful place. I've been there. She got a bachelor's and a master's in nutrition and dietetics. That's not an easy word to say. Also got a postgraduate certificate in allergy and ended up becoming the secretary of the Dublin branch of the Parkinson's Association of Ireland. Also is involved with Young Parkinson's Ireland. She's an ambassador for the World Parkinson Congress in 2022 that's coming up. And I know you both have been very involved in previous World Parkinson's Congresses, and Eli, who's one of the Avengers, is also instrumental in putting that together. But both of you, Omotola and Richelle, have been so sort of key in working with women and their causes in Parkinson's, as well as young onset Parkinson's disease, highlighting the specific needs of these populations and really the unmet needs of these populations. So really commend you for those things, but wanted to let Richelle teach us a little bit about her passion for diet in Parkinson's and really the multidisciplinary approach that is needed to take care of Parkinson's patients. Welcome, Richelle.
Thanks,
Maybe
Lillian.
first you can actually tell us a little bit about your Parkinson's story as well, and sort of your journey with getting the diagnosis and kind of how you got to meet the Avengers and your piece in it.
Well, I mean, firstly, I want to say thanks a million to you and to the PMD Alliance, because it was actually through you reached out to me and saying, how can I help you, when you saw me sort of active promoting around our cause. So I really appreciate that you have given us this platform, and you've just an amazing array of speakers. So we're privileged to be up there amongst them. I suppose in terms of my journey, I'm a dietitian by background in terms of what I work at. And actually I was pregnant. I was 3 months pregnant, and I was in my clinic working, and a patient came back to me after about, I don't know, it was about 7 years or something, and I took out the record card. I was writing in record cards, believe it or not, and it wasn't online. And I noticed that my handwriting was much smaller than what it was the 7 years previous when that patient had seen me before. And I thought, oh, that's a bit strange. And then I tried to make my handwriting bigger, and I couldn't. And I thought, that's even stranger. So I thought, what's that about? So I, as many people do, went to Google and researched it, and micrography came up. And Parkinson's kept on coming up. I was trying to find some other thing that was linked to micrographia, and I couldn't find. So the other thing then, I was skiing. Well, I wasn't actually skiing, but I was skiing with my family. I obviously wasn't skiing at 3 months, but I was having a hot chocolate waiting for my husband to come down off the slope, and my hands started shaking. And I remember specifically saying to him, oh my God, as long as it's not Parkinson's. And so then the penny dropped, and I thought, okay. Now I actually don't have a tremor. I only had that tremor for a couple of weeks during my pregnancy at that time. And I don't know whether it was the cold, because sometimes the cold can set off tremors and things like that. So I went to my GP and said, I'd like to see a neurologist, please. And went to see the neurologist. He kind of said, you're too young, you're too fit. I had a very healthy pregnancy. I had no symptoms bar the micrographia, really. The only other thing that I noticed was when I was turning my fork, you know, when you're doing spaghetti bolognese and you're twirling the fork on the spoon, I couldn't twist the fork as much. I thought that's a bit odd. And then the other thing was, I was at a Bruce Springsteen concert, you know, and I love Bruce Springsteen, and we were all hands in the air. And I noticed I couldn't shake my right hand as well, as really subtle, like really subtle things. So they were my only symptoms. And I had an aching shoulder, which I was going to a physio for, kind of elbow pain and sort of like aching shoulder, which subsequently I found out was obviously a Parkinson's symptom, because a lot of people who have frozen shoulder, you know, that can be a sign of Parkinson's. So so I've been treated for that for ages, and nobody picked up on it. But so unfortunately, I went through an MRI, I went through, you know, nerve tests. Because I was pregnant, I obviously couldn't have a DAT scan. One of the problems while I was pregnant, and I couldn't go on any medication because obviously they couldn't do the diagnosis. So I had to wait until my baby girl was born, and then I couldn't get a DAT scan while I was breastfeeding, because I'd have to stop for 5 days. And anyone who's breastfed knows that's pretty damn difficult to do, and to restart feeding after 5 days, and painful for both baby and mother. So at 8 months, when she finally stopped breastfeeding, I had the DAT scan, and yeah, it was positive, basically. Now I had been seeing an OT who kind of, you know, agreed with me that, you know, possibly this was the case. So I had myself sort of almost set up that it was likely Parkinson's. However, even though I knew in my gut it probably was, I sort of had two reactions. One, to be honest, I was glad it wasn't ALS, you know, in terms of, you know, just putting, I suppose, things in context. And I suppose I was glad it wasn't a brain cancer, but it was still a shock. You know, I still remember, I think as many people do, the date of diagnosis, and, you know, pretty much the kind of, here's a prescription for medication and off you pop, you know. So obviously, as being a health professional, a dietitian, I have spent years advising people with chronic disease about how to manage their health, and you know, helping people in terms of behavior change. And also I was the president and CEO of my professional dietetic body in Ireland, so I had done a lot of campaigning for people with various different chronic conditions. I had seen people with Parkinson's myself. I myself realized that I didn't even realize when I was treating people with Parkinson's that actually you could get it when you were younger. And so I was really quite taken aback myself. So that kind of was my journey. So basically my type is not tremor dominant. It's sort of, you could say, sort of more the rigid type. And so it's been an interesting journey in terms of medications. And I suppose for me, unlike Omotola, I didn't immediately go into advocacy, because I was actually, I was afraid of judgment, to be honest. I was afraid of judgment, of what people would think, what my clients would think, in terms of, you know, that I was lesser than because I had a brain condition. Would they think differently in terms of, you know, coming to see me? Would my colleagues see me differently? So yeah, there was kind of a lot of, I was reluctant, and it kind of went against the grain because I'd done so much advocacy. I also have celiac disease. So I'm on the board of the Celiac Society here in Ireland. I'm chair of the clinical advisory group, and I've done an awful lot of advocacy around celiac disease in Ireland. And so it really was going against me that I was hiding it, to be honest. And I did. I hid it for 2 years, and I could hide it because I didn't have a tremor, so I could kind of get away with that. But it was hard. Like things like trying to write was difficult. You know, I had 2 kids. You know, stress, as many people Parkinson's knows, you know, can add. Fatigue was high. Though when I started meds, that definitely made a difference. But it was actually when I went to the, it was a colleague of mine, Gary Boyle, in the Young Parkinson's Ireland, had gone to the WPC conference in Portland, I think it was, and he was blown away by it. And so the Young Parkinson's Ireland were very good and funded a number of us to go across the WPC in Kyoto, and that just blew me away. And Omotola was one of the people that blew me away, along with a lot of other, you know, young onset Parkinson's people. And I was nervous because I was afraid to go and see other people further down the line than me, to be honest. I was kind of, you know, I was like, oh, but you know what? It was so empowering to see even people who were further down the line how they were coping and how they were managing and, you know, standing up for themselves and, you know, doing whatever they could in their power. And they were just the most fantastic bunch of people from, you know, 20s through to 90s. Like, it just was unbelievable. And I suppose the other thing was the Congress was like the biggest Congress in the world that brings patients and researchers and medics together. And I would thoroughly recommend, if the next one is in Barcelona in 2022, so please God we all get there face to face. But it was really empowering, and the research was, as a dietitian, I went from that point of view because I was really interested in the microbiome, the dietetic side, because I've done a lot of research myself, and you know, the multidisciplinary care side of things. I went to there was a training day for multidisciplinary team members, and it was just amazing. And I suppose what I learned there was how far behind Ireland is in terms of multidisciplinary care for people with Parkinson's, which is really surprising because in Ireland, we're very much the forefront in terms of cancer care, diabetes care, cardiac care, but neurology, we just aren't. We don't get the funding. We have one of the worst ratios of neurologists to patients in Europe, which again for Ireland is really pretty quite shocking. We don't have access to DBS, albeit that the people who make DBS are based in Ireland. So people who want DBS have to travel to the UK or the North. Well, actually the UK at the moment, and of course the COVID, that's a problem. We don't have, we've really poor access to Parkinson's disease specialist nurses. We've got 6 in the country, and the ratio we should have is nearer to 35, I think. So there's lots of problems. And for me in my journey, I traveled to the Italian Parkinson's Therapy Centre because I couldn't find multidisciplinary care in Ireland. And that is a fantastic centre in Italy that's been set up by someone who has Parkinson's. And they have neurophysios, and they you know, had various different speech therapy, etc. Because I couldn't get it here. I traveled to the Oxford Parkinson's to learn there, and obviously went to Kyoto. And I suppose that really started my journey in terms of when I came back. I just thought, I've got to do something about this. I can't keep silent, you know, that we have to change. And I suppose back to your point in terms of what we call non-communicable diseases. So that's your cancer, your diabetes, your cardiac disease, your respiratory diseases. They all get funding. So the WHO last year came out and classified mental health and neurologic disease as the 5th NCD. We are so far behind in the care we get. And back to Omotola in Africa, like, it's absolutely, you know, ridiculous that they cannot, and to even think that you would give someone Parkinson's meds for a year and that's okay, and no longer. I mean, can you imagine any of us on this call were suddenly told, oh, sorry, well, we can't give you medicine anymore. So, you know, so I suppose that's really where I was quite passionate from. And I know in terms of my own journey, I had a sort of swallow issue. I felt like something caught in my throat. I had to clear my throat all the time. And I spent probably, you know, I feel really bad about this when I hear about the cost of medicine in Africa, but I probably spent about 1,500 euros getting various private access to, you know, scopes and, you know, reflux, you know, and various people checking, and all kind of saying to me, oh, you know, it's nothing to do with Parkinson's. And I was like, And it was actually in Kyoto that there was a speech therapist who actually presented on the fact that everyone with Parkinson's should get a video fluoroscopy at baseline. And I went home and I said, right, I'm going to ask for this. And I pushed and I pushed. And basically, to cut a long story short, when I did have visual fluoroscopy done, they said, actually, yes, you have the swallow of a 65-year-old. I'm 51. So the research would show that up to 80 to 90% of people with Parkinson's have swallow issues of some form, but only 3 to 6% report it. Because a bit like the arm swing not swinging, people don't notice that their swallow has a problem. And I feel really quite passionately that if you leave it until it's too late, not swallow, from a dietetic point of view, one of the biggest killer of people with Parkinson's is aspiration pneumonia and swallow problems. So I think it's absolutely horrendous that, you know, our older folk with Parkinson's aren't getting this care. If whatever about us, it should be paramount. So I just feel, sorry, I've done a lot of talking there, but I feel quite passionately about that. And then access to dietetic care is not happening. And so many people with Parkinson's have bowel issues that aren't been dealt with, swallow issues, weight issues, you know, things to do with overeating, you know, a whole range of things that aren't been dealt with within multidisciplinary team care. So that's really what really drove me to become a Parkinson's ambassador for the WPC. And then when I was asked by the guys, you know, Larry and the guys to come on board the PD Avengers, I was like, yeah, sign me up. We've got to do something about this. So that's my journey.
That's amazing. So it sounds like you guys really connected at some of these meetings and then found sort of a group energy to kind of keep the sort of dream alive and keep each other motivated. I know you guys meet and support each other. I see you on Twitter all, you know, hyping each other's different, you know, you each have your own kind of organizations and then are kind of publicizing each other's work, which I think is so beautiful, sort of lifting each other up. So there's been a few comments here just to kind of echo what you guys have talked about. A few things about relief when the diagnosis was given. Gam says, better to the devil you know, and now is 79, shouldn't try a handstand. There's been a couple of comments about, you know, the waste that happens sometimes when somebody passes away. They may have, you know, the family may have a lot of pills that are left and, you know, unfortunately we can't figure out a way to use those. And I think, you know, we can't even recycle them at the hospital. You know, if you brought unopened bottles, they're pretty restrictive of how we can, you know, kind of use those for other patients and stuff like that. It sounds like a few other people, and I think a couple of the themes that you guys have shared today is just that between Omotola and you, that the diagnosis was delayed, especially when you're young. And so people just don't understand that this is something that affects young people. And so I think educating, you know, even physicians about the fact that Parkinson's is not just a disease of, you know, 80-plus-year-olds is really such an important thing. And I think, you know, just, I think there's some relatively, you know, low-hanging fruit here about, you know, trying to just, you know, teach people, get the word out about how common Parkinson's is. And there is a pandemic really of Parkinson's right now. Cases have doubled in the last 40 years and to double again in the next 20 years. And so definitely, you know, I think we all have to work together to get this word out. Otherwise it's going to be a longer and longer delay, you know, and with, you know, COVID and people not seeing doctor, who knows how long people are waiting to get and seek care. So I think definitely empowering to teach people around this topic, and happy to help you guys in any way around that. Richelle, there's been a question or two about, since you're, you know, have this dietetics background, could you teach the group a little bit about sort of your kind of, you know, top things that you teach Parkinson's patients about what to eat and what to not eat?
Well, yeah, that probably takes a webinar on its own.
Yeah,
but,
we'll have you back for that, but maybe just, you know, a few nuggets.
Absolutely. But yeah, I mean, I think in terms of the, I suppose it depends in terms of obviously as well age and that in terms of what may be going on for people. So, you know, if people have dysphagia, you know, in terms of swallow issues, then, you know, looking at textures diets and making sure that they don't lose weight, because as we progress, unfortunately with Parkinson's, weight loss is quite typical. So what I would say, actually, one of the key things coming into the COVID winter period is vitamin D. So I'd absolutely say, if you can get your vitamin D levels checked, I would do that. If you're deficient, the research is showing that that is more risk for worse than, you know, if one did happen to catch COVID. The other thing I would say is also to go and, you know, if you have any concern around swallow, or even if you don't, I'd start, you know, talking about trying to get an SLT, because although we, you know, aren't at any high risk of catching COVID, our risk is if we got it and ended up, you know, obviously in our lungs, it's harder for us to deal with the sort of breathing and coughing reflex and things like that. So from a diet, definitely the vitamin D supplementation. I won't go into levels. The basic level will be 10 micrograms a day, but obviously it's different, you know, it's 400 IUs in the States. There are some research to show higher, but I wouldn't do that unless you speak to your neurologist or, you know, your GP, etc. The other thing I would say in terms of your diet, the research is showing the Mediterranean diet has, at the moment, the most research to show benefit for, you know, potentially preventing, which obviously for a lot of us here is a little bit too late, but also in terms of, you know, helping, I can't say progression, but, you know, definitely helping people with Parkinson's. I think one of the things is constipation management is a really key thing. So a lot of people with Parkinson's, you know, so research again would show that, you know, when people are asked if they have constipation, about 30% of people would say that they do, but actually when they actually did an objective measurement of them in terms of their bowel, it was more like 60% actually had constipation. So I think people sometimes get used to that they've been constipated, which is a prodromal symptom of Parkinson's for many. So it's really important to get good fiber into the diet. So that's whole grain fibers. So that's your whole grain breads, your whole grain pastas, you know, different grains, quinoa, you know, bulgur wheat, you know, all sorts of different grains to help, you know, what we call nature's broom, help you to pass a stool. But the other thing is, in terms of for the Mediterranean diet, is getting lots of fruit and veg in your pulses, because they have soluble fiber, which help to sort of soften the stool to help the stool to pass. Because the problem is, if you're constipated, it can mean that you don't absorb your medications well, you know, so, and that can obviously worsen your symptoms. So what I would always say to people is, like, get the basic foundations right by really looking at your diet. The other thing is, with the fiber, you need to drink plenty of fluid. So we know people with Parkinson's don't drink enough fluid. Some of that is to do with dehydration because of the meds. Some is because we've lost the kind of automatic trigger to remind you to drink. So make sure you drink a pint of water with every tablet you take. For example, if you're taking Stigma 3 times a day, that's a good way to sort of get the foundations right. In terms of coffee, I just want to dispel a myth. Coffee will not dehydrate you unless you're drinking, you know, 6, you know, shots of coffee a day. But if you're having 3 cups of instant coffee a day, that's perfectly fine. It helps to hydrate you. In terms of real coffee, it would only be 1 a day. So 300 milligrams basically of caffeine would be the amount. But I kind of be against saying don't have caffeine, because there's a lot of research to show that caffeine may have benefits. So in terms of the bowel, that's really important. So if you have any bowel issues, I would talk to your Parkinson's nurse about that and get on top of that. Would be another thing I would recommend. And the other thing then is protein and your levodopa. So there's been really interesting research done in, I think it was in a European country, I can't think where it was off the top of my head, but it showed that although people know about the fact that your protein foods can interfere with your levodopa absorption, your cinnamat absorption, most people aren't following the advice, which is basically take your tablet half an hour before you eat or an hour after you eat. And it's an hour after because obviously it's to let the food digest. And the reason, you know, to avoid taking the levodopa or cinnamat with your protein is because protein competes for the same absorption site as your cinnamat. So that can affect your symptoms. So you can have what we call a protein sparing diet to sort of help you be more on during the day, but it's really important to do that under the guidance of a dietitian or a properly qualified nutrition professional, because again, with people with Parkinson's, bone health is really important. Weight, keeping your weight up and not losing weight is really important, because, you know, in terms of falls. So, you know, just be careful not to reduce your protein. It's just about timing around your meds. So those are probably kind of some of the key things that I would say for people to watch out for. Yeah. So
that's amazing. No, I mean, I think there's so much to talk about. We are going to have a dietitian on, a dietitian that works with Mike Oken, because I do know that that's an unmet need. And then Richelle will happily have you back as well again to teach us.
I think I'm linking in with her, Carrie, I think is her name. I've linked in with her.
Carly. Yeah,
Carly, that's it.
Yeah, she'll be coming on. So yeah, would love to have you tune in as well for that. I mean, this is just so rich. Each of you is just so amazingly, you know, smart about so many different things. So I think one thing, Richelle, that I wanted you to highlight, you just did a program for women with neurological issues, you know, trying to highlight the need to care more about Parkinson's patients and specifically the issues of women with Parkinson's. Could you tell us a little bit about that?
Yeah, so basically, not unlike how we connected, there is a group called the Women's Brain Project, who are promoting basically, you know, basically as it says on the tin, you know, around mental health and brain health for women. And they had a conference there recently. So I reached out to them and said, you know, are you aware that there is a real issue with regard to Parkinson's in women, and we have specific needs that possibly aren't been met in research or been looked at in terms of our you know, specific needs. So they are basically trying to champion that. They're actually looking to set up an actual neurological foundation just for female women's research, which I think would be amazing. So So I suppose it was highlighting them a couple of things. Like, so for example, with levodopa, women tend to absorb it much quickly because of our lower body weight. So that obviously can then have, women tend to have more dyskinesias, more dystonia. And obviously in terms of menstrual cycles. So what's really interesting, a couple of things that I've noticed is that my symptoms came on around my pregnancy. And a number of women with young Parkinson's I have heard say that they were diagnosed in and around either when they were pregnant or after their pregnancy. So, you know, there's definitely something interesting there with regards to, you know, immunological, because it's quite common, say, for women to get a thyroid disease after, you know, pregnancy. So it definitely triggers the immune system. So, you know, that needs to be investigated. And then a lot of people, Omotola would agree with this, I know she shared about it as well, in terms of women who are still menstruating, totally notice that their symptoms get much worse during their periods. So there is something to do with the menstrual cycle and the estrogen, and it's to do with the window before, the week before your period actually arrives. And then subsequently there is the whole issue of, you know, there's more diagnosis of women postmenopausal, so there is something about the estrogen having some kind of protective effect. So there's all these areas that, you know, aren't probably being researched. So this Women's Brain Project, along with a number of other, they're definitely worthwhile linking in with, because they're trying to campaign to get the 50% of the population, you know, basically, you know, that there's research around us. Because I think also for men, potentially the benefit of research around estrogen and how it affects could, you know, be good for men. You know, if you could get something that medication-wise could help men also, you know, that's estrogen based, who knows? So so there's a lot of kind of things there, and obviously from a young person's point of view, it's a lot of people are, you know, trying to juggle being a mum, you know, having maybe a job, and, you know, etc. as well. So yeah, there's a lot of things there.
Yeah, I mean, there's so many issues that are unmet for women with Parkinson's. So we're hoping to have Allison Willis soon. She hasn't booked a time yet, but she has done research with the Parkinson Foundation, and we hope to have her on soon. And then we are going to have Nabila coming on, Dohadwala, who looks at some issues with underserved communities, you know, and in Parkinson's as well. So October will be highlighting some of these unmet needs, but definitely so much to talk about around that, and as well as the concept of young onset Parkinson's disease as well.
And actually, just on that, there was a study done in the UK, and it's actually a study that Bas Bloom is working on with a dietitian who's a project manager on it. And they recently came out with a paper showing that women were generally diagnosed. So, you know, they sort of say that there's more prevalence of men, but actually now they're beginning to wonder, is it just because women aren't diagnosed as quickly as men? So they found that there was a lag, and that women tend to or men get to see a neurologist, women don't.
Yeah.
And I know that as well, hearing people, they're often told, oh, you know, it's to do with menopause, it's to do with anxiety, it's, you know, kind of in your head. So there seems to be a kind of a stigma there, or a bias against women in terms of actually getting earlier diagnosis, which I think is really important, considering a lot of people here identified with the diagnosis journey, you know?
Yes, absolutely. I think that's a huge unmet need, that there is a delay, and that women sometimes, you know, are stoic as well. They don't necessarily seek care. There's a huge lack of getting deep brain surgery in Parkinson's patients who are women as well. And if you're African American and a woman, the statistics are even more striking. So definitely so much to unravel, uncover, and unpack, and try to make changes, you know, in this current situation. So couple of comments. Gavin, who is on the video, who I know does amazing work in Uganda, I think, wrote that Omotola is one of the most remarkable people I've ever known, yet she's actually human and actually has Parkinson's. She has done magnificent work and will do so much more. But please understand that toll it takes. I implore any and all PD orgs to get involved in the Africa cause. So worth it, so needed. Please expand your reach. $1 there goes much farther than same anywhere else. Thanks for the great work and show. And then Jean asks about how do you actually donate to these international sites? Because it's harder than just writing a check here, and how do you know which one? So maybe, Omotola, you can kind of guide. I'm assuming it's also possibly on the Avengers scene, but
Andrea just helped me answer that question. That's what I was going to say.
Okay.
Go to Parkinson's Africa.
Perfect.
Click
Andrea's
on
always
project, and you'll see a link there.
She's always
All of the funds on that you donate are going directly to purchase medication for patients in Africa. All of it.
great. Great. Well, thank you, Andrea, and we'll link those with this video as well. And thanks, Gavin, for your continued work as well. So last 5 minutes, we knew this was going to fly by. Unfortunately, I could talk to each of you for about 3 episodes with all the knowledge that you have. So wanted to ask you sort of, maybe you could tell us the secret sauce that you think is helping your Parkinson's sort of in your daily lifestyle or whatever it is, or anything, each of you. And then also, if you could tell yourself now something about, just looking back, if you could, Richelle Omotola now, thinking back to the person that you were and reaching out to that person that you were when you got diagnosed and giving them some advice that you've learned. So secret sauce and sort of a wisdom pearl that you didn't know now that you didn't know then. Who wants to go? Yeah, go for it.
My secret sauce, honestly, is in giving of myself in service to others. The feedback and what that does for me, I cannot really put or express in words. But when you give, it does something for your soul. And that has been the driving force for all the work that I have done. It's actually, I don't want to say it's selfish, but I think I get more from what I do than I actually give. So that's my secret sauce. And, I want to piggyback on what Gavin said, and please implore everyone to please go online and donate. Your contribution, no matter how small, really goes a long way to changing the lives of people who are living under conditions that many of us cannot even begin to imagine. In terms of what I would tell myself, I'm going to cheat and tell you 2 things real quick. The first one is, don't compare yourself to other people with Parkinson's. I experienced cognitive challenges, and many people don't see that. But like sometimes when I'm talking, it's as though I'm looking at a teleprompter that's changing languages. It starts in English and then goes to French and then German. That's what goes on in my head. But I look at other people and I'm like, they don't seem to have that issue. And I put so much pressure on myself. So it's go easy on yourself. And then the second thing is take the damn pill. I wasted, I wouldn't say I wasted, but I didn't take medication for the first 2 years because I wanted to fight it by myself. And I think I lost valuable time that I could have been using to exercise and slow down the progression even more. So take the damn pill.
Great. Okay, Richelle.
Yeah, oh my gosh. I think in terms of connection has been really key. For me, in terms of the community of Parkinson's people have been really important. So I'd say when you're first diagnosed, even if you are, it takes people different times, to decide when they want to come out, and some people may not want to, and that's a very personal decision. But I think even if you don't want to, come out straight away, is to get a community around you. So join your local Parkinson's group. And that was really important for me, the young Parkinsons, to know that I had other people who I wasn't alone, to just help me sort of acclimatize and to reach out. And I would agree with Omotola about the advocacy is really important. I suppose in terms of my own personal, what helps me is definitely the exercise, but also mindfulness has been really important for me to keep calm and grounded. I've really got into that. And obviously the diet. I mean, a dietitian, I kind of go, well, should have got Parkinson's, and I felt I kind of hit myself up for a while, but actually just realized these, we don't ask for these things. We have no reason. We don't know why these things happen. So all we can do is do what's in our control. So I suppose for me, that's the secret sauce is it's the thing. I use the serenity prayer, which is, God grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. I'm not religious, by the way, but it's just something that really, it's about what's in your control. So that really helps me. And I suppose just in terms of finishing off is saying that we really need people to join us and to stand up and shout. And one thing, what I would say is I noticed in the Parkinson's community, we're very quiet, and that's actually figuratively in terms of the condition makes people quiet, vocally because of Parkinson's, because of apathy, etc. So if you have a voice and still have a voice, I would just implore you to become a PD Avenger and, you know, get behind us. And we really need to start campaigning a lot more for ourselves to get better treatment and better equity to access for care around the world, no matter where you are.
Thank you so much. That's so beautiful. I mean, I think that's a great end to our series here, is to really just join the voices together, and together we can make a loud enough kind of shout or cry to be heard, you know. And I think there is power in numbers. There is power in these voices, and, you know, your goals are, you know, every week these numbers are increasing and increasing, and slowly, you know, we'll have the numbers there to really make a difference. So I think, you know, so blessed to have you both in our world, and thank you for all the work that you're doing. And thank you for coming on. And Richelle, thank you for helping organize this. You know, I think it was really a treat for everyone to hear about all the great work that you're all doing there. And Omotola, thank you for fighting that fight in Africa. It's just so needed. And, you know, every time I hear more, it sort of breaks my heart a little bit about these stories, but hopefully together we can educate and empower the people there as well. So thank you both. Andrea, I'm going to pass it back to you, and you can close this out.
Okay, so Richelle and Omotola, put it on gallery view. I invite everyone joining to turn on your camera if you've had it off. So across the oceans, we can look each other in the face. Maybe we're all a little misty-eyed, and just send our gratitude and share the love in this digital way. So thank you for joining us. Thank you, Indu. Thank you, Richelle. Thank you, Omotola. This was beautiful.
Thank you very much,
Thank you
guys.
so much.
Thank you very much. Have a good day.
Okay, take care.
Bye.
Bye.
Bye.